I'm Sanjay Rao. I'm a medical oncologist. I treat people who've got skin and thoracic malignancies. As we move through life, we're always faced with the need to make decisions about things that affect us. And of course, healthcare is no different from that. It can be a worrisome time for people when they're faced with a serious illness, whether it's cancer or anything else. But I think when people do take the time to make choices, take time to understand also all the different issues that might affect their illness, that it might affect the people around them. While it can be an overwhelming time, they're taking an active role in making choices can also, I think, help to regain some of that control that people feel they might have lost during the time of their diagnosis and the subsequent management of their illness. Although it's hard to quantify exactly the benefit of making decisions for yourself, there is a potential psychological benefit. The experience of going through the healthcare process can be better just because of active involvement.
Personally, as someone who's now been a patient and someone who's in healthcare as a physician, new physician, it's always been something that's important to me. I'm someone who's very proactive kind of by nature. Sometimes choice is overwhelming, so it can make it really, really hard. But I think it's so important to involve the patient and kind of give the power back to them, because it's such a time where you feel powerless. And trying to improve your health, a big part of that decision can really help kind of give the patient some power back.
I think when I finished my training, I already had an idea that patients would be better served in their journey if they're encouraged to be involved in decision making. In fact, I think as I've gone through my career, which is now 20 years, my interest in seeing patients get involved in their own healthcare decisions has actually become strengthened. I don't see my role as someone who makes decisions for people. Over the years, I've come to understand that people just want to be heard and respected in that way. Sometimes they make, again, decisions that have them embark on an alternative course. Sometimes they choose not to have treatment at all. And again, that's their right. And we respect that. When there's family members or caregivers involved, a lot of them in some cases will have the patient turn to them and say, well, what should I do? I think they also see a value to having that person involved in their own healthcare decisions.
I really was proactive in my cancer journey. So I have red hair, I have fair skin, I have moles on my body, blue eyes, all the risk factors for skin cancer. For me, it kind of took a lot to kind of trust my gut. We're moving away from more of the patriarchal system in medicine and giving that power back to the patient. Now, on the provider side, I really do value kind of how my patient is feeling. And if they kind of have this gut feeling of this isn't okay, something's not right, I'm going to take that to heart and investigate what's going on with this patient. We try and break bad news perfectly, but I don't think it can be perfect. I think as the patient receiving the bad news, it's always going to suck. As the physician, I think we put so much pressure on ourselves to try and do the best we can. I now have a lot of grace for that, because as the patient, those aren't the words I want to hear. If I can use my words to make that better and feel safe and heard and have the space to grieve in that moment, also answer their questions and help them feel empowered to make those decisions and move forward, then I feel like I've done a good job.
The biggest thing about melanoma and skin cancer is that in the past, it's been very difficult diseases to treat. They've often come with very poor outcomes and treatments that didn't have a lot of benefit. A lot of people may not understand how things have changed in terms of what treatments we have to offer and the benefit of those treatments. There have been marked improvements in outcomes. I think generally people are more informed about healthcare. I think there might still be misconceptions that we need to help iron out. And that can be something that's important, especially in our first discussions and of course, throughout the course of their treatment. I think a lot more hope we can offer to people. We have to make sure that our goals are aligned with those of the patient, present both sides of the information well, and that asked and answered appropriately so patients can make those decisions.
Treatment decision was what took me the longest to actually make a decision. Just because the treatment was a year long, there's obviously side effects, some of them irreversible. As future physicians, always leave the door open for your patients, make sure they can contact you. But as a patient, that is way easier said than done. It's hard to contact your physician. Obviously, you don't have a direct line to them. There are many barriers to even accessing that care. Like in today's current landscape of healthcare, that's becoming harder and harder for physicians to do, to allow their patients that extra time, extra appointments to kind of discuss things.
When you promote the importance of patients make choices for themselves, then those patients will naturally become the center of your effort. I think that when people do become responsible for themselves, developing a personalized care plan for them also becomes a bit easier. And patients will decide for themselves. There are certain risks that they're willing to accept for a certain benefit, and that's a framework we can work within. But we have to understand that there's limits as to what we can offer or accomplish in that particular framework.
As a patient, and especially when you're someone who's diagnosed with cancer and then has surgery and then has treatment, it's a long process and it's tiring. And I found myself advocating for myself a lot. I don't feel that I wasn't really heard by my care team. I'm a proactive person. And so I kind of came out with all my questions ready. Of course, it obviously helped having a medical background because I'd already done my research, the treatment options and all the different kind of choices I was going to have to make.
If you just take time to listen carefully, to answer questions, I think that goes a long way towards patients and their families feel that they have been heard. In many cases, life experience may shape how people look at their health. And we know that people have different socioeconomic backgrounds, educational backgrounds. These are all important things to be aware of. And as you hear about these elements of their life, you can integrate that into your discussion framework and begin into that patient-centeredness framework. But it also helps me and the healthcare team around these people to establish a foundation so that we can make management plans which are in keeping with that patient's perceptions and interests. It gives us a better relationship to carry out this plan that we hope to implement.
It is really important to me to ask my patients what their goals are, because then I can better help them achieve those goals. I think that also fosters trust with patients because then they feel heard and they feel like you understand. My goals changed from needing to continue on with medical school to doing what's best for my health. Checking in with your patients as well on, have your goals changed? Like, how are things going? All of those questions foster trust and understanding with your patient. It produces better outcomes for everyone.
Establishing that communication is very important. And as we've discussed, the idea of having someone feel that they've been heard and that their concerns have been recognized does go a long way towards establishing trust. And you have to continue to do that with each visit, with each encounter. During whatever the management course involves, you have to make sure that perceptions and goals are considered and also revised as needed, because management of healthcare problems can be quite dynamic over time. Perception may change, goals may change, especially if we're not getting the response we hope to get at the outset, and we're having to make different plans. So again, it's important for people to remain informed during that time, to make sure that the lines of communication are open. I think sometimes direct questioning helps to do that. And I might just ask someone if they're satisfied with how things are going, if there's something that needs to change, if there's more information they need. So it's more just constantly making sure that you maintain that communication. That can be, it's hard to overemphasize, I think, that particular aspect of patient care.
I think that it's probably a pretty common feeling for people going through a cancer diagnosis to feel isolated and to just feel like I'm the only one going through this and this is such a scary time. And of course, I had an amazing support system around me, but they were all going through their own difficult emotional journey. And so I think as the patient, it can be quite isolating and you feel alone. But when I connected with Save Your Skin Foundation, was like, oh, I'm not the only one. There are survivors, there are people who've gone through treatment and are now okay. Just emotionally comforting to be able to communicate with Kathy, the CEO of this big foundation called Save Your Skin. Kathy's a wealth of knowledge. She's connected to physicians and people in the melanoma space. She was able to connect me and guide me a little bit, even just listen and hear me. Save Your Skin also has these really helpful resources. That connection for me was extremely important.
As patients often on their own will try to get in touch with different sources of information outside of the regular healthcare system. And I do tell people when I've had experiences with some of the advocacy groups, or patients have come to me to say that they've had good experiences, that new patients should also consider reaching out to some of these resources.
Be an advocate for yourself, because if you feel like something is wrong, then go after it. It's not a perfect system, and also doctors aren't perfect. It's not an easy thing to do, to be your own advocate and to look after your own health. Right? It's hard as a patient to take it all in, to have a conversation, like a meaningful, connected conversation with your provider, but then also remember everything that was said. Involve your support system, ask them for help, ask them to come to your appointments, because all those things, it's just so helpful to have those other people, and you feel emotionally supported as well, just having someone in your corner.
There's a lot of information out there, and it can be hard to sort through everything. Not all of that information is necessarily of good quality. So I think the important thing is that I'm always open to discussing things that people come across. And, I try to direct them again towards what we might consider approved sites of information, which offer a balanced view of whatever's out there. And as I say, if there's a clinical trial or some other thing that they've heard of that they'd like to talk about, we always have time to do that. I try not to discourage them from seeking information, but at the same time, we try to have a discussion about they make sure that their concerns are being heard and their questions are being answered before they make decisions.
I mean, this is a process. This is not just kind of done in one appointment. Understanding those goals and then talking about the different treatment options. I was the one who had the final say in that decision. That was really important because it was like, I made this decision to fight and do everything I can to try and make this better. My life then became, I am fighting this cancer and healing right now. You're in a better headspace when you're doing something that you've elected to do, rather than when you're kind of being dragged along by someone else who's made that decision for you. I think it's probably one of the most important things is patient choice, that overall satisfaction and well-being.
The broad problem we have with healthcare in Canada is that we lack resources. Cancer care in particular, but not just cancer care, is multifaceted. You need a lot of input from a lot of different healthcare practitioners, I think, to get patients the care they need. We need to address other aspects of patient health and wellness, both psychological as well as physical. So the resources are lacking. And as much as, during a consultation appointment, we like to try to address at least some of these things. Again, we have a finite amount of time and we can't spend the time that's needed as physicians to address all of these different issues. And of course, I don't have the expertise, to tell people about nutrition or about physical therapy or all these things either. So we do need these other inputs, but we struggle even just to provide regular care. So I think trying to get all these other components included is a challenge. I think in the cancer care system, there are people that are dedicated to making sure that patients have the care they need. And I hope that patients and their families understand that we try to work within the limitations that we have and hope for better days to come.
Like my experience, feeling that maybe I was taking up too much time, or that my physician didn't have enough time, or that there just weren't enough resources to facilitate that. As a patient, that was kind of the biggest obstacle. And I think that translates further into people who don't have a family doctor. I was having conversations with my family doctor. That was extremely important as well, like emotionally, practically. But I think in terms of the patient choice, that's going to be kind of the biggest obstacle, is how do patients access their providers? What about patients who don't have family doctors? The system as a whole is kind of contributing to this obstacle of access to care.